Okay, here we are. I'm back. This is Angel. And for this part of the event, I'm so excited. You're going to get to tour the operating room here at Cool Springs Plastic Surgery. Dr. Moore had a vision a long time ago of starting this, having his own operating rooms where he could do his procedures on site. And that's how it works. Most procedures are done on site here at the Brentwood location at Cool Springs Plastic Surgery. Now, before you get to do that though, you call the office, you set up a time for a consultation with one of our awesome phone people. They'll answer the phones, you'll ask the questions that you may have, they'll help you as much as they can, and then they'll talk you through the process. Once you're on the books for your consult, you'll come in, you'll get to meet with Dr. Moore or Dr. Sarosiek. You'll ask all of your questions, they'll give you their thoughts, they'll give you their recommendations, and from there y'all get a plan of action. Once that is done, you'll get a calendar date on the books. You'll move forward with that. Once that date arrives, you come here, and this is where you'll come in to have your surgery. We'll get to go see that. We'll walk up the stairs. I can't wait. It's awesome. So, you're here for your surgery. What a great day. You're going to come up to the second floor. This is where our two operating rooms are located. You'll head in this way and get to meet some of our pre-op nurses and get started. It's going to be great. Follow me. So, here's Alethea. Let's head into the pre-op room, and here we go.
Hi, I'm Alethea. I'm one of the pre-op nurses here, and when you come in for surgery, you'll come in this way, and then we're going to take you into a little pre-op room where we're going to get you ready, okay? All right. So we're going to bring you in here today, and with the procedure, I'm going to just sit here first of all. We're going to go through a few things about your medical history in this room this morning, and today we will have you talk to the surgeon in just a little bit. Okay. He'll come in, he's going to talk to you, he's going to go through everything y'all have talked about preoperatively. Anesthesia is going to come in and meet you. He's going to sit down, go through all your medical history, talk to you about the anesthesia you're going to have today, okay? We'll get your blood pressure, your temperature, kind of get your vital signs, make sure everything's okay. Any questions you might have, we'll go ahead and go through that. We also will go through some information as far as what to do when you leave here today. At this time, you won't have any medicine that's going to make you sleepy just yet, because we want to make sure that you are comfortable and talk to your physician and surgeon about everything you went through, okay?
Right.
And when you go home, we give out printed instructions. Your family will be notified during the procedure. We will call them from the room. We notify them, update them a few times. At the end of the procedure, the surgeon will call and talk to them personally, go through some things and steps about going home. And then we'll get you changed in the pre-op area and get you a gown, get you a warm blanket, and get you settled and comfortable on the stretcher. And then, like I said, the surgeon's going to come in and talk to you, okay?
Okay, so at this point, Alethea, I might be a little nervous, have a little anxiety.
Yes.
I'm still going to get to talk to my doctor and my anesthesia provider.
Yes,
Am I going to get a little medicine to calm my nerves?
Yes, you will. And I know that, everybody is very nervous when they come in and scared. That's why we are here with you in this room to provide you what we can to make you feel better and to give you the best care. Mm-hmm. Your surgeon will talk with you, like I said, mm-hmm. and then anesthesia will come in. As soon as everything is answered and you've gotten changed, you've gotten a warm blanket, then we'll get you on the stretcher, we'll get a little IV going. When you're getting ready to go back to surgery, after everybody's talked to you, then we will give you a little medicine in your IV, okay? Mm-hmm. You'll start feeling a little bit as you leave this room, and then when you go down to the OR area, you'll be very relaxed. Most people do say they do not remember even going in the room, okay?
So this is good news. I was going to say, to have the medicine that relaxes you, you don't have to be anxious and full of anxiety. And then once you are ready to go, Alethea, sweet Alethea, as well as several other of our great OR nurses are going to be available to make sure that everything goes so smoothly,
Yes.
as well as Dr. Moore and Dr. Sarosiek.
Right.
They are top of the game, those
Amazing.
guys. Amazing doctors. So from here, we get to act like we're on our stretcher and get to see the most shiny, beautiful part,
You will.
which is the operating room.
Yes.
So let's head that way.
And one thing too.
Yes.
And, I'm not sure we covered this, but when you go back for surgery, we reassure your family. We call them, talk to them, give them an update or two just to let them know that everything's fine in the operating room. Give them an update of progress of the surgery, any questions they may have or concerns, and then we will also call them at the end of the procedure.
Great.
Your surgeon will. And they'll call, talk to you, go through everything as far as surgery, little things to look out for when you're going home. And then we will give you all kinds of information for your family, printed instructions, and we also, with any family member has any questions, anything like that, we make sure that they are on board with everything. They will have number access to get in touch personally with their physician that night and the next week. It'll be their cell number. Okay.
Great. So that's so great. They're going to call my family along the way,
They will.
reassure them, make sure they're feeling well. I love that they're communicating with them all along the way. It's not just scary, because they too will have a little anxiety. They'll be a little nervous, and that's typical and normal.
Yes.
So from here, we'll head on into the OR. So here we are. We're ready to go into the OR. I'm not going to be by myself. There's a team with me. I'm on a gurney. I'm getting sleepy, remember. I'm not going to remember this probably. And in normal circumstances, I don't have on my earrings or my makeup. I have my glasses, which they've taken away. Don't have my contacts in, things like that. Also, notice my beautiful hair. I've got my beautiful hat on. Super, super sanitary and sterile. This is the area that nobody can really go in unless they're covered. Normally, I would have my socks on. We would have shoe covers, all kinds of things. That is one thing we do pride ourselves on, is the safety of our patients. So we make sure everything is sterile and safe. So, but here we go. This is exciting. Shiny, clean room. Follow me. So here we are heading into the OR. Very safe, very sterile, very sanitary. This is Lynn, one of our OR nurses. We have great staff here at Cool Springs Plastic Surgery. Super caring, very, very nice. They want to make sure that I'm going to feel comfortable, safe, and warm while I'm having my surgery. So let's head in.
Let's do it.
Here we are. Isn't it beautiful? So safe, so sterile, very clean, state-of-the-art, awesome operating room. And we're here with Lynn, who's one of the team that's going to be in the operating room with us, as you remember. So, who all's going to be in here with me, Lynn?
So the surgical team consists of the surgeon, the RN, who would be me, the circulator, an anesthesia provider, also a first assist, and a surgical tech. So there's a large group of people who will be here taking care of you.
And let me just say that even though our OR is just 3 years old, our team has many, many years of experience. Dr. Moore handpicked all the great people that works here at the office, as well as all of our locations, and he picked a great team. Lots of experience, no newbies. We know what we're doing. So, what's going to be happening on this end?
So what will happen is we will wheel you in, and we'll just switch you from the stretcher to this OR table. Anesthesia will be standing at the head of the bed. I will be hooking up your compression sleeves that will be going on and off during surgery just to prevent blood clots. Josh will be hooking you up to his monitors, an EKG, a blood pressure machine, and a pulse ox. And then I'll have our surgical tech and our first assist over here. And then the surgeon will be standing on the other side. Once we get everything hooked up and we're ready, Josh will, or whoever our anesthesia is, will, just ask you, it's time to go on vacation. Where would you like to go? And then he'll put you to sleep, and then the rest is just us.
And then Alethea reminded me that y'all are calling my family along the way.
Yes.
And so is that you or somebody else on the team?
That would be the circulator or me, whoever's the nurse in here that day. Yep, I will call and just let the family members know that we're asleep, everything's going well, and just update them that way, because I know family can be very nervous. It's very nerve-wracking, but I just calm them down and make sure that they know what's going on, keep them updated.
Right, which is so nice. And then it's keeping everyone safe again, like we say, also communicating all the time with our patients and their families. And then when you're done, we're all finished, we're all sewn up, ready to go. We'll get to go to recovery where Lynn will hand us off to Alethea, and then we will begin waking up. So here we go. So we've come out of surgery now. Everything went beautifully, I'm sure. And now I'm headed into recovery. Lynn was in OR with me the whole time, and she's driving me on my cart into recovery.
All right, and once we get over here, Alethea will hook her up to all of her monitors. I will give her a quick report, as will anesthesia, and I will just let her know what we did and how it went, and then it'll be Alethea recovering her.
Yes. And
so what happens now?
Okay. So you're going to be received from anesthesia and the circulator. We are going to have you on this stretcher. You're going to have like a sheet, and then we're going to put this nice warming blanket on you, okay? And then the first thing we're going to do, we're going to hook you to a lot of monitors. We always do the first thing we do when you come in. You'll be very sleepy. You will not remember any of this at all. We want to make sure that you're just told all this, so that, we'll be kind of touching you and everything, that everything's fine, okay? We'll put a little probe on your finger for oxygen. We hook you up to an EKG machine just to make sure everything looks good, and we get your blood pressure. It will go off quite a few times while you're here in surgery, that hour, okay?
And so that's kind of like what you've seen on TV.
Exactly.
The beeps are going off, and that's all very normal.
It's very normal.
Okay.
You're going to hear people talking. You're going to hear us covering you up. We're going to hear us positioning you, and then you're going to start waking up, and we're going to, first thing we're asked you, how are you doing?
Right.
And then we're going to also explain your surgery is over, you're in recovery room, and everything is fine, and at that time, your surgeon always is in here in recovery with you when we're waking up, and we'll sit you up, get you comfortable, and then when you're awake enough to know that you want something to drink, we'll get you something to drink. And at this time, we'll start assessing how you're feeling and what your needs are.
That was my question. So am I going to start beginning to maybe feel a little pain at this point?
Yes, and everybody will feel a little bit of discomfort. And at that time, we'll ask you, we do a little pain level. We ask you 0 is no pain and 10 is the worst. And you'll give us a number, and at that number, we can indicate what we need to start doing to give you pain medicine. That will help you and get you sitting up and getting you ready to go home. All right.
And so about how long will I spend in recovery, Alethea?
Usually around an hour to hour and 15 minutes.
Okay. So we've had our surgery. We have finished in recovery. We have all of our clothes on. We're in our wheelchair. We're going to go meet our loved ones. They have been communicated with all along the way. They're very comfortable with what's going on. Also know that you have a phone number. Dr. Moore and Dr. Sarosiek are easily reachable if you have any questions or concerns along the way. It's not like you're going to go to a voicemail and maybe somebody will call you back. You will be able to call and speak directly with your surgeon. They're very good about that. And that's the good thing about Cool Springs Plastic Surgery. We are hands-on. We want to meet our patients' needs at all times. Always. We want to be available. So remember, if you want to call for a consult, 615-771-7718. You can talk to one of our awesome phone girls, maybe me, and then you can get that on the books. So remember, for the event, you can click on the link, and you can you do the shop online. That'll give you all the options for the specials. And then remember, you can call the office if you have any questions. And then you can call the office and schedule your consult for your surgery. So we look forward to our next happening. See you in a little while.